Hello, my dear friends. Welcome to Aspire 32. And today we have another very important topic that is about not just one. There are two important topics in this podcast. One is about the orofacial pain certification from US, and plus the certification that is a residency for orthodontics in USA. And I'm excited to welcome Dr. Karthik. Dr. Karthik, welcome to Aspire 32.
Thank you, Dr. Shanu. Thank you for having me on this podcast. I think you're doing amazing with Aspire 32. I can only imagine the countless number of lives this podcast is helping, and I'm happy to contribute in my little way.
Thank you so much, Dr. Karthik. And I'm sure today's topic is going to change, help so many students. I know you finished dentistry in India and then you shifted to the US. It's an exciting journey. I have spoken to many people. Like we had one speaker who spoke on pediatric residency. One speaker spoke on endodontic residency. Ortho is something is very difficult, and I think we should thank our friend Dr. Mayank that he connected us, and I'm so happy. So let me just ask you the very important question is. How did you think that why did this thought came that I want to go to the US after my dentist?
So I'm going to start off by giving a brief introduction about myself, Dr. Shani, for the viewers. So I completed my BDS in India from St. Joseph Dental College. It's a dental college in Andhra Pradesh. I graduated in the year 2009. And after that, I was into practicing general dentistry for about like 5 years. And in those 5 years, it was an intense 5 years. I was actively associated with, of course, treating patients, but also I was into a lot of clinic management activities also. And during that phase, orthodontics was something that excited me. Of course, that was also the one specialty which I did not want to get my hands into already because I felt the formal training to treat an orthodontic patient. I didn't have those necessary skills. So the thought process to get into orthodontics started at that point. Moving forward in 2014 is when I moved to the United States for my MBA in healthcare management. And during that course, I was actively applying. Yes, of course, I was doing the MBA, but also I was actively applying to dental schools. And that is when I found out about an orofacial pain program at the University of Rochester. And during that program, I was able to actively also associate myself with the orthodontic department, and which laid the foundation for my later admission into orthodontics. So yeah.
Yeah, so it's amazing to hear because you have done together in Rochester, both the certification and Dr. Mayank in his last podcast did explain his experience and how it was very fruitful. Of course, there is one question which even I'm still wondering that you did your orofacial pain and then orthodontics. This is without doing DDS, or you did the DDS degree before doing this?
No, I did not go through the DDS route. I had directly applied to the orofacial pain program and then into orthodontics. So one can also do that, and so that is the way I went through.
This looks very, when I talk to people, many people tell me it is very challenging to get into the certification programs with a DDS, and listening to you who has achieved this, I'm sure many people also can dream. And I just want your opinion that do you think even today this is possible that you can directly get into these type of certifications, can get recognized to practice in United States by doing this residency?
Yes, what I believe, Dr. Shanvi, is that it is possible. It's something that can get challenging at times, but it is not something that is not impossible. When you are approaching the admission cycle, the one thing I always tell someone who asks me on these lines is that number one point is that the admission committee should understand your intent, that you're doing it from your heart, you love that specialty, and you've invested a lot of time, energy, effort into understanding that specialty. Once they get to know you well, once they understand that you have the right motive and you have the right drive to take that specialty forward, I think it is definitely possible.
Okay. And you did the orofacial pain certification. I had one question because I have heard somewhere that there are multiple specialities which can allow you to practice in the United States. But in India it is like you have fixed like ortho, prosto, endo, there are no one. But I have heard that in the US there are some additional branches. I am not sure whether this orofacial pain is included in that, but it is a recognized degree which if you have, maybe you are able to practice that. Is it true?
Yes, 100%. And now, orofacial pain specialty is one of the specialties that is approved by ADA. So, in addition to orthodontics, periodontics, prosthodontics, and all the other specialties we have in dentistry, orofacial pain is one additional specialty which got included into that list very recently. I believe it's been about 2 or 3 years that, or yeah, something like that, 2 or 3 years. So, it's a specialty that you can practice. Yes.
And you finished the MBA first. Was it a step, to make sure that you can get into this residency or certification, or is it that you had actually planned DDS and then you came to know about this information that there is this is a certification, isn't it? Is it? I'm not sure. Is it a residency or certification, or it means the same?
So, residency certification, it almost all means the same.
Okay.
Yeah.
So you finished the MBA, and I was just very keen. Whether did you think of this first, or you had the conventional process that I will do the DDS and then I will shift here?
So MBA in healthcare management was an intentional decision that I had made, and this stemmed out of my 5 years of general dentistry practice in India. I was working for a corporate hospital back at that time, and as you may know by that. In addition to the clinical aspect of dentistry, there is also this business aspect of dentistry or running an office. And the office that I was working for had multiple branches. And sooner or later, I wanted to also understand on or get a formal training on how to be able to run a chain of clinics, which was eventually is what I want to do in life. So MBA was an intentional decision I made at that point. However, I also wanted to use that time to be able to prepare myself to apply to dental schools. So that was the time when I was taking my board exams. I was preparing for, working on my profile, working on volunteer opportunities, and that actually helped me. I think that set the ground. Those 2.5 years of my MBA set the ground for my future admission process also. But at the same time, yes, MBA, that knowledge I know is somewhere in the future it is going to help me to have my own chain of practices.
So then how did you come across this information that you can get into this orofacial pain certification? Did your senior help you, or did you found it on your own?
So I have one of my senior who was at the same time working or applying to the AGD program at University of Rochester. Came across this program, and he mentioned about how the program is great. It has great faculty. There are a lot of graduates who've been working out of that, graduated from that program, and are working as dentists. So that is how I came across the program. I eventually ended up applying to it and getting through it. Yeah.
Great. So you finished your orofacial pain, but I'm sure the admission to orofacial pain certification was also very difficult. Can you please give some tips to the students on exactly how they should be preparing? Because you said that the committee which is going to decide your admission would really have to feel that you want to do this certification. So how was your interview, and how can students prepare better for this?
Okay, so I can tell from my experience that orofacial pain is now becoming one of those specialties which is again getting very tough to get into. So number one would be get in touch with the faculty, let them understand your intent of how you want to advance your understanding about orofacial pain, and if possible, I would also recommend trying to publish a case report, or the journals, or also have some kind of publication effort towards orofacial pain. Another great tip would be to get in touch with people who have already graduated from orofacial pain. They can give you a very good understanding of what the program is going to look like, what the program, what the core elements of the program will be in terms of is the program a more research-based program, is the program a more clinical kind of a program. So these tips will help us to get a brief understanding, or get an overview of what the program is, what the faculty is trying to get into, or set the team of residents. What are they looking for? So these are some tips that you can use when applying for orofacial pain.
I'm sure since this is a certification course, there would be some fees associated with that, with it, and since our viewers are majority are undergraduate students, Can you just give some idea about how much fees or expenses are you will have to pay for completing this?
So yes, great question. I think it depends on which university you're applying to. There are some universities which pay you stipend towards your residency versus some universities which you have to pay a fees for. So again, the fees can vary anywhere between $25,000 to about $50,000. Again, it depends on which university you're applying to.
I'm sure the curriculum would be very interesting because we know differential diagnosis is something which is closely associated with how you can differentiate pain. Although we do stress here, but it is not a separate branch. But the students do get confused, and sometimes patients do visit saying that they have pain, but they don't know where is the pain, and we are also confused. And I think this certification, this residency of orofacial pain is something related to that. So, how was your experience, and how was your day like when you were in this orofacial pain residency program?
Yes, I agree with you, Dr. Shani. Orofacial pain can get complex at times, even as providers, understanding pain, diagnosing it, and then how do we approach the treatment part of it can get totally exciting and challenging also at the same time. Orofacial pain for me was one of those programs which made me have a whole lot of respect for pain now. The residency itself was fun. We had a great team of doctors and at the same time a great team of residents at that point. And a typical day would look like starting off with having core classes. We had to take those classes, even though it is a certification program. We would still end up taking those core classes because that was part of the curriculum. You still have to meet those CODA requirement standards in order to be able to, have that program accredited. So core classes, and then we would start off by taking a look at patients, understanding what the patient's pain kind is. Is it a myogenic pain, neuropathic pain, or myofascial, and or is it simply a TMD case? And we would then have journal clubs later into the afternoon, and and again, ending the day, we would still be doing another round of patient care. So
this was for 2 years.
This is a 2-year program, yes.
And again, how many exams?
Yeah, I'm sorry.
Yeah, please go ahead.
Yeah. Also, that depends on which university you're applying to. Sometimes it can be a 2-year program. Sometimes it can be a 3-year program. And a 3-year program would typically come with a master's degree to it.
So I believe if you want to practice dentistry in the US, majority dental boards, state boards expect you to finish minimum 2 years of certification. Yeah. Because if there is, I'm sure some university may be also providing 1-year certification, but I think majority time students do not know that by doing 1-year certification, you may not get a license to practice. Is that true?
Yes and no. There are some programs which do 1 year. For example, there's this 1-year AGD program that you can do and then still end up getting licensed in states like Virginia. But I would recommend always try to aim for the 2-year program, because to be able to have a good understanding of what you're learning, you will need some time. And I think 2 years is a good time frame in which you can establish a sound understanding of what you're going through. Additionally, I would also recommend, for the licensing purpose, it's always good to have a 2-year program, because you just don't want to have license in just one state. It's always good to have license in at least a few states. It gives you a better option to be able to look for employers, and if in case, if for any reason, if you did not end up liking that place, like for example, weather or any one of those reasons, then having the option to move on to another state is always great.
How many states, if you can mention it here, how many states do you think a residency in general can allow a practitioner to practice?
I think it's anywhere between 12 to 15 states right now. But again, the good news is that after a few years of practice, like about 2 to 5 years of practice, other states also open up with reciprocation. So initially, it's only about 12, 15 states, but then the number just keeps going better or higher.
I think I read it on the board website that you have to submit the application saying that you have this experience. Please consider. This is what I had read one time on their website. That's amazing. I'm sure you really enjoyed your facial pain management certification. But then you did decide to again do the orthodontics. I'm sure maybe that was your dream to getting into orthodontics. I'm really not sure about it, but looking at the end milestone, maybe it's a beginning of another success story also. But you did again the orthodontics. And why did that thought come after the orofacial pain management certification?
So orthodontics was something which I always wanted to do, even as a general practitioner. Like I mentioned earlier, orthodontics was something which excited me. I think the simple, elegant way the treatment is performed, and with simple tools, I just felt orthodontics is something which I wanted to do for the rest of my life. So yes, orofacial pain was something that I enjoyed thoroughly doing, and as a general dentist, I was involved in root canal procedures, crown preps, but orofacial pain was something which helped me learn something new in dentistry. It is not something that is very extensively taught or even practiced in India, and the opportunity to learn something that was something new to me was exciting. So I used that orofacial pain experience to to be able to understand and treat pain patients better, even TMD patients better. But that was only a part of me being an overall, I should say, like a comprehensive dentist. Okay, but orthodontics was something which I always wanted to do, and I wanted to see myself as an orthodontist for the rest of my life. So that's the reason why I ended up again applying to the orthodontics program.
That's amazing. And finally, your dream did come true. I had just one another question here. That did you practice after the orofacial pain management certification, or directly you got into the residency program of orthodontics?
Yeah, I got a little lucky over there. I applied directly to the orthodontics program right after orofacial pain. So it was one program graduating and then entering into the next one.
So does this mean that if you have a certification in Rochester, some other certification, will your chance getting into this residency orthodontics, will it be easier, or the weightage is equal if you have done some other certification? Why I'm asking this question is when my students, even when I was applying, I thought of applying for Rochester, and I think not every university replies to all the students, but I've seen the Rochester University replying to the students. That is something I really appreciate, because I had sent so many mails, and it was only Rochester and few of them who replied me saying that in a positive thought. So what? But then I realized that in majority of the other universities, with an MDS or with work experience, they would not directly prefer you for any residency program. So what do you think if you directly come from India? There are two scenarios. One is a BDS person. One is a MDS in orthodontics. What do you think? Can they directly get into this residency programs, or do you think they should do some American certification before they apply here?
Great question. So I think if you, in scenario number one, if it's a BDS student, if the student has some kind of additional training in the United States, it kind of helps, not only in terms of understanding how the education system in the United States works, but also in that specialty. It also sets a great platform for the admission committee to kind of be able to assess the student if the student is going to be a good fit for their team, because end of the day, it's just not about that one student. The admission committee is trying to set up a class together. So if the resident is going to be a good fit with the other residents in the program. So these are some details which one will be able to understand better when they're doing a certification program in the United States. And I think that is not just, and that applies not just to University of Rochester, but to any university. If the candidate already has some kind of training, or some kind of publication, or some kind of research work, or some kind of foundation in that specialty, then I think it helps the candidate, yes, get the application. It kind of goes up a little compared to the ones who have maybe not as much of experience, but having some kind of certification definitely helps. In the other scenario, if it's an MDS in orthodontics candidate who's trying to apply for a residency program, again, it also helps because the candidate has already an understanding of orthodontics. I'm pretty sure the clinical skills are also high in that case. The candidate also has research experience and for the thesis publication. So in that way, also the candidate is a good fit or for applying to a residency program. Yeah.
Great. So I'm sure that is beautifully answering the questions which I asked. And how much is the fees? Is it more than the fees which is for orofacial pain management, or it will be drastically different?
More or less, the fees is the same. But again, the answer comes back to which university you're applying to. There are some universities which pay you stipend for doing the residency, and some universities you have to pay them back as tuition fee. I think the tuition could range anywhere between $50,000 to about $75,000. Again, the answer to that is depends on which university you're applying to.
So this would cost almost half compared to the DDS program?
More or less, yes. But that was only the fee for 1 year. So I should say for that, about $50,000 or $75,000 for 1 year. So if the program is a 2-year program, you end up paying about like $100,000 or $150,000.
So this costs around 60-70% of a DDS. This is what we can believe.
Yes.
Because I heard in Indian currency, the DDS program is almost 1.5 crore. This is like people are saying 1.5 crore minimum now. So I don't know if for residency, shall we consider somewhere around 1 crore for including the expenses?
Yeah, more or less it comes to that, yes.
And how will the bank finance? Is it easy to get a finance for residency programs than the DDS program? Are the rules same for both?
More or less, yes. It also depends on the bank that you're applying to. Having a co-signer to back you up is always a good idea. But these programs are well accepted by banks as well, as long as it's a code accredited and the standards are always met. Banks are always ready to help you with that. Yes.
And how was your? I'm sure as a BDS student in India and with so much of work experience in the dental clinics in India, you must have seen how the orthodontic cases are done here. And what do you think? Do you believe that we are able to match all the qualities here, or the way the orthodontics is done differently or taught differently in foreign universities?
So one thing I can tell you, Dr. Shanvi, is that here in the United States, we go through learning a lot of bracket systems, and that is something that we go through during our residency program, and that makes you confident about whichever practice you get into or whichever bracket system you end up choosing. That is something which I believe is a little different from the United States and the Indian orthodontics. I honestly, the last time when I was in India was in 2014 when I was looking at the orthodontist in the office provide his treatments. I remember he was using a O22 system of braces. I'm not sure if things have evolved from then to now in India, but I think in the United States, the number of bracket systems and that we use or are confidently able to use are a whole lot more. So
currently in India, there is a lot of advertisement
yes.
on the aligners. Some orthodontists do not support this because there is a home delivery of the aligners. I'm sure, like, I've seen clinics also putting boards saying that patients do not have to come and they will come and scan, and then the aligners will be delivered.
To the
How
house,
is the practice in United States? Do you think it is so much commercialized there too? Because I'm sure in India, when things are generally invented or that thought comes, they are generally seen outside. They import that thought majority times. So, is it the same scenario? I'm sure you must have heard when you talk to your orthodontic colleagues in India. You would have heard that this is the trend which is happening in India right now. Which I'm not sure whether it is right or wrong, because I'm an endodontist. I don't touch the orthodontic cases. There are many general practitioners who are into the aligner treatment.
In the United States, also there are some companies, or there are some firms which deliver the clear aligners at home or to home, but that is not something that is supported by the American Association of Orthodontists, and I don't believe any orthodontist would also support that. We still recommend patients to come to the office and always be monitored by the orthodontist, and something that is not unsupervised is not something that, as orthodontists, we would agree on that.
Very good. Very good. So I have two last questions to you. One, what are the most important things undergraduate students should keep in mind during the early days of dentistry so that their journey becomes easier in foreign countries like United States?
Yes, great question. I think the first thing an undergraduate student should start looking into when thinking about going overseas for education is first sit down with your family, make them understand what your intent is, and tell them how it is important that you do this, because this is how you see yourself into the future. The reason why I say this is because it becomes important in terms of managing finances. Overseas education can come with a lot of expenditure, and sometimes that expenditure is more sensible, or I should say, it makes more sense if that education it ends up getting you into a licensure, it ends up getting into a good job. Otherwise, you end up making not as much money, or the expenditure versus the income, it doesn't match that ratio. So one has to be clear about the expenditure that they're going through. That is number one. Number two, what I would recommend is having a good mentor, someone who understands the process, or someone at least who has been through the process, or someone who is able to guide you through the entire process in terms of not just applications, but also coming up with your SOP, coming up with recommendation letters, helping you build a profile in terms of, let's say, publications, or even helping you through your exams. Having a good mentor is super important. Also, work on your building your overall profile, like work on your leadership skills, help volunteering with dental camps, or even participating in extracurricular activities. All this is something that helps really build a good profile when you're putting it on your resume, and these are some things that admission committees definitely look into. So these are some tips that you can start working at. I would also recommend taking your TOEFL and GRE at an early stage, maybe even in your fourth year of dentistry, or even during your internships. Sometimes working on the TOEFL score becomes super important, because nowadays I think the minimum score that universities are looking at is at least 100. So if you're able to hit that mark, good. But if you need some time to hit that 100 or 100 plus mark, you would sometimes need some time to be able to do that. So getting good scores is also super important. It's a good thing now that national boards is it's just a pass or a fail, and it's not score based anymore. So that works in your favor. And at this point, it's integrated into the
One
INBD,
exam.
and so it's just one exam that you have to
Yes.
take. So that kind of helps a lot better. So yeah, start early, prepare well, have good mentorship, sort out your expenses well, and hope for the best. Yeah. A long answer to your question.
No, that's very important. I think because people have dreams, but they don't. They have to be also make sure. They also should make sure that all these important things, which if they don't do it, they might get disappointed at the end of the night. Of course, your journey was amazing, and I'm sure you have been practicing happily orthodontics. But one last question is that what else do you continue to plan to do something after, like you did orofacial pain, then you did orthodontics. So what next after orthodontics? Is there anything new which you can do after this course?
So what I have in mind for future is I want to get into faculty teaching. That is something which I've always been inclined towards. So in the long term, I see myself in that direction. I wish I also find the time and the energy to be able to do a PhD in orthodontics. That is something that would be I would be interested in, but we'll have to wait and see if that actually becomes a reality.
Great. I'm sure you must be missing India and all this is COVID situation,
Yes.
with all this stability. Do you think that because I have visited US and then I came back first thing I realized that everything is super cheap, in India when it comes to expenses. Sometimes we don't realize it unless we visit foreign countries. I'm sure since you are in US now, then you might be missing some important things in our country. Also, is it India? So, is there any some? Do you really think that every student should plan to move abroad, or in India also things can be better based on your opinion?
Yeah, what I think is things in India are also changing. They're definitely not something that is the same from when I came to the United States. Things have evolved a lot, and I think even the dental schools are getting to the point where we are preparing great dentists. Even the market is, I believe, not the same from what I hear from my dentist colleagues who are practicing in India. I think the consumer market has also evolved a whole lot. From when I moved to the United States. So yeah, I think definitely the prospects for dentistry in India is looking bright, and I hope that in the future dentists or graduates don't think of moving out to other countries and can continue to practice in India, because home country is home country all the time. So it's always better to just be close to your family, close to your friends, and also enjoy the practice of dentistry, something that as dentists, or something that we could not do maybe 10 years ago, dentists in the future can do that.
Right. Thank you so much, Dr. Karthik. It was amazing to listen to your journey, and I wish you all the best for your PhD. And I hope that many more students will be able to train under you when you become a faculty in any dental institute, dental school in US. Once again, really thankful for giving your time, and this was a wonderful podcast to listen to.
Thank you, Dr. Shami. Thank you for having me on this podcast. Congratulations with Aspire 32. I think you're doing amazing. It's an amazing job with this platform, and I hope more and more aspirants are able to get as much as possible from these podcasts. Thank you so much for having me on.